this video, I'll walk you through what to expect on the exam day, how to revise in the days leading up to the exam, and what essentials you need to carry on the day. So if you're new here, this video will give you an insight about the exam, but for more details, you can watch the beginner's guide video, which is available on the channel. It has details about the exam format and the marking scheme. So let's start with how to prepare effectively in the last few days leading up to the exam. So many candidates find it very difficult because there's a vast material to be covered and they don't know what to revise. So I'll tell you some really important things that you need to revise in the last few days. Starting with the short stations, in the cardiology station, you need to revise how to present to the examiner a summary of the following conditions: aortic stenosis, aortic regurgitation or a mixed aortic valve disease, mitral stenosis, mitral regurgitation or a mixed mitral valve disease, valve replacements, VSD, and hypertrophic obstructive cardiomyopathy. These are very important and common conditions that appear in the exam, and you should be very fluent. So in the summary, you would revise the exam findings, how to investigate and how to manage the condition. Some common viva questions are the markers of severity and surgery indications or indications for valve replacement in some conditions. So a template of presentation for aortic stenosis is given on the channel. If you haven't watched that, you can go through it to get an idea. Also revise the INR targets in case of metallic valve replacements of aortic and mitral valves. On to the respiratory station: interstitial lung disease, bronchiectasis, pleural effusion, thoracotomy scars, and COPD. These are very high yield. The most common one are ILD and bronchiectasis. You should be very fluent in presenting them, the examination findings, the investigations of choice, and the management. So in the investigations, when you're mentioning the imaging and pulmonary function test, please remember to mention what you'd expect in those findings. So for example, in PFTs, do mention whether you'd expect an obstructive pattern or a restrictive pattern, or typical CT or X-ray findings in certain conditions. For pleural effusion, revise the Lights criteria. For surgical cases such as VATS or thoracotomy scars, the indications for lobectomy, thoracotomy, pneumonectomy, and single versus double lung transplant. For the abdomen station, chronic liver disease, renal transplant, liver transplant, combined renal and pancreatic transplant. These are really important. Also, the differentials for isolated hepatomegaly, isolated splenomegaly, hepatosplenomegaly, with or without lymphadenopathy, and with or without anemia or jaundice. These are separate categories and the differentials should be on your fingertips. Practice presenting these cases, mentioning the specific investigations and the management plan. The management should include both pharmacological and non-pharmacological measures. For the neurology station, practice the presentation of upper motor neuron and lower motor neuron lesions in the following manner. For upper motor neuron, with normal sensation, with dorsal column being affected, with cerebellar signs, and for lower motor neuron lesions, with or without wasting. Practice the differentials well. Also, mention specific investigations instead of a myriad of basic investigations. The examiners do not like that, and the management should include a non-pharmacological approach, emphasizing on the social aspect on the patient's life as well. So including a multidisciplinary team in every management plan and specifying who would be a part of the team. For example, an occupational therapist, or an occupational health worker, a dietitian, nutritionist. Especially for cases in which speech or swallowing is affected, involve the SALT team, which is a speech and language assessment team. Besides these cases, cranial nerves, specifically the third and seventh facial nerve, and the examination of tremors to differentiate between Parkinson's and benign essential tremors with cerebellar tremors. Okay, these are the short cases. Besides this, something that is often overlooked are the DVLA guidelines. You're not expected to have a vast knowledge of this, but these are the few conditions that you should be aware of: TIA and strokes, seizures either due to epilepsy or other causes, PCI and MI. So a rough estimate of the duration that the patient needs to stop driving for in a patient who drives a car versus who's involved in public transport or a heavy goods vehicle driver. So a rough estimate would give you a satisfactory score in the clinical judgment. If you don't know it, that's fine. But these are the few conditions that you ideally should be aware of. Okay, these are the things that you need to revise. Besides the preparation, if you're traveling to another city for your exam or another country, you need to plan ahead. Travel a few days before the exam so you can take into consideration if there are any delays or maybe traffic that could delay your arrival time. Also, keep your belongings with you, including the admission document, which is a roll number slip that the RCP mails to you a week before the exam. So you need to print it out and keep it with you. Ideally get 2 or 3 copies, so even if one is misplaced, you wouldn't have to get it printed at the last moment. Keep one form of identification with you, that is either your ID card or your passport. You should be reaching your destination ideally a day before the exam so you can rest well too. Now, for the things that you need to carry with you in the exam is basically just your stethoscope, Classic 3, Litman, Cardiology 4, either one is fine. Even if you have Classic 2 and you're well practiced with it, that's fine too, but ideally Classic 3 or Cardiology 4 would be preferable. Besides this, some candidates like to carry their own ophthalmoscope. If you already have one and you've been practicing with it, you can carry it along. But if you haven't got your own ophthalmoscope, that's fine. You don't have to buy it, especially for the exam. Everything will be available there. You just need to know how to operate one. So everything will be available there: torch, tuning fork, clinical hammer, cotton balls, neurotips. So for those who don't know, in the neurological examination, for the pinprick sensation, you would have neurotips there. You just twist off the cap and use it for pinprick sensation. And then there are yellow bins available there. Just discard them over there. You don't need to carry anything else besides your stethoscope. Now, about the dress code. Let's start with the male dress code first. So, no full sleeves shirts or no t-shirts, no jeans. This is all really prohibited. Basically, this is against the dress code. And the dress code in the UK is bare below the elbows. So, ideally, you should be wearing a dress shirt, a button-down shirt with your sleeves rolled up, so you're bare below the elbows. Also, they should be well ironed clothes, and dress pants. Avoid denim jeans. You shouldn't be wearing a wristwatch. You can use a watch, either hook it into your belt loop or hang it from your pocket. Keep it in your shirt pocket, but don't keep it in your pant pockets, because once you sanitize your hands, it wouldn't be feasible for you to put your hands in your pocket to take out the watch again. They wouldn't like that. Also, avoid wearing ties. Anything that could fall over onto the patient, or um, anything that can come in contact with the patient should be avoided. Everything should be neatly tucked in. Okay, now for the females, I also would like to mention that scrubs or white coats or overalls should be avoided too. They don't seem professional. The scrub suits and overalls are against the dress code of being bare below the elbows. For females, you can wear similarly button-down shirts with pants, or if you're wearing shalwar kameez, that's fine too, but make sure that the scarf around your neck is tied in at your back, so it doesn't again fall off onto the patient. If you're wearing a hijab, make sure that it's loose around the ear so you can put your stethoscope in with ease, and it should be just neatly tucked or draped around your neck. If you're wearing a veil or an abaya, that's fine too. Make sure that it's not really overflowing. Also, the veil, that before the exam starts, the exam coordinator would confirm your identity, matching your face with your identity card. So at that time, they would ask you to pull down your veil, so you should be prepared for that. During the exam, you can put your veil back on, except if some examiners could ask you to pull it down, so be prepared. For the females who don't have pockets in their dresses, there are some lapel um, watches. You can just they have a pin attached to them, and you can just pin it to your shirt. They hang from your shirt, and you can just glance at the clock, at the watch, and just count the timer. Although it's not really necessary in the exam, they don't expect you to count the exact pulse rate or the respiratory rate. There are clocks available there for you to check how much time is left. The examiners do give you a warning when 2 minutes are left, so you don't have to worry much about having a watch on you. But if you want, there are pinned watches available too. You should avoid jewelry, any kind of jewelry. A plain wedding ring or a wedding band is okay, but except that, nothing else is allowed. You would be asked to take it off before the exam. And for men who want to wear their traditional clothes or shalwar kameez, that's okay. Just roll up your sleeves above the elbows. Now, the night before the exam, after 6 or 7 p.m., you should just, close your books, stop revising, and get a good night's sleep so you're well rested before the exam. Put in an alarm, tell someone to wake you up on time. You're asked to reach the exam center 1 hour before the exam starts, so you should ideally reach an hour and a half before the given time, so you can account for any delays or any traffics on the way. Reach on time. At that point, they would ask you to confirm your identity, show your form of identification, either passport or your ID card. They would take your sign, and they ask you to deposit your belongings with them, and they'll give you a token to collect it after the exam. At this point, they will give you a card with your exam number, your RCP code, and your picture on it, and you'll be asked to clip it with your shirt. This is a form of identification for examiners while you go from station to station. Now, when you reach the exam center, you would be taken to a waiting room while your identity is confirmed, and you're asked to sign and deposit your belongings. They'll then give you some feedback forms. There are 16 sheets. So there are 5 stations, and except 2 stations of long clinical consultation, all the other stations have two cases in them. That is communication and abdomen, communication and respiratory, cardio and neuro paired up, and then 2 LCCs. So a total of 16 stations, a total of 8 stations, but there are 2 examiners, each have their own form. So at each station, you would take 2 feedback forms. Don't worry about it because you don't have to carry these around. The exam coordinator will take these sheets from you and give it to the examiner while you're examining the patient. So before the exam starts, these feedback forms are to be filled with your examination number, its center number. Make sure you fill them well. This is just an example of how to fill them. The number at top, and then fill the boxes. All this information will be on your admission document, the roll number slip that you've printed out. So everything will be given there. So before the exam starts, the chief examiner and a couple of more examiners would come and greet you, ask how you're doing, give you a little brief of what's going to happen. They'll reassure you, and the only tip that they'll always give you is don't examine over the clothes. So this is a short way to flunk your examination station. Never ever examine over the clothes. Always ask the patient for permission, get an adequate exposure, examine, and then cover up the patient. You never auscultate or never put your hand above the patient's clothes. So once the exam is over, you can go watch the beginner's guide video for the station to station overview. It's discussed in detail in that video. Once the exam is over, you'll go give your token, collect your belongings, and they'll give you a review form or a feedback form. It's about the examination center, the local examiners, and how it went. You can give your review there. So it's confidential, but that's just how the exam goes. After exam, if you're in the UK, you would receive your result within 3 weeks time, and if you're appearing in an international center, you can expect it in 4 to 6 weeks time. So thank you for listening. If you have any queries, you can leave a comment or DM me. You can follow PACES guide on Instagram. Some long clinical consultation examination checklists are given there that could help you in the revision in the last few days. And if you want any help, I provide one-on-one coaching for both communication and long clinical consultations. So you can DM me for more details. Thank you.